still have some feedback. Let's try and fix that. Okay, good morning. Oh, that sounds so much better. A most pleasant good morning to each and every one of you. Welcome to 2026. A very, very happy new year to all of you who I would not have seen, which would pretty much be most of you. I wish you all the very best this year in your life, in your health, in your career. Welcome to the 2026 series of continuing medical education brought to you by your Department of Continuing Medical Education. We are so excited to begin our sessions again to bring you information to help enhance your professional life, and to help the outcome of the patients that we serve in the Bahamas. This year, as with every other year, we like to get you started with a topic that kind of grounds you, that kind of makes you reflect, to make you refocus on your life, on your career, and to get you the boost that you need to have a wonderful and productive 2026. Before we begin, as we always do, let us have a word of prayer. Father God in heaven, we are so thankful for this another opportunity to come together as colleagues in the healthcare profession, oh God. We ask you right now that you would open our minds, that we would receive the information that will be presented to us today. And we ask that this information that we receive, that we're able to apply it in our daily lives for ourselves, as well as we are able to use the information to help others around us. Be with the presenter, oh God, as we go through this presentation. This I pray in Jesus' name, amen. So this morning, we have a wonderful topic for you. And to present that topic for us is none other than Dr. Tameka Johnson Dames. Dr. Tameka Johnson Dames was born in Nassau, Bahamas, and is currently employed at the Sandilands Rehabilitation Center as a senior registrar. She is married to Alec Dames, and they have one son, Amir, and a daughter, Amia. She graduated from St. John's College as a deputy head girl in 2006, and further her education at the College of St. Benedict in Minnesota, where she obtained a Bachelor's of Arts degree in 2010. She then completed her Bachelor's of Medicine and Surgery program from the University of the West Indies in 2015, and her doctorate of medicine in psychiatry in December of 2022. Being passionate about the development of young women, she serves as the president of the Young Ladies Auxiliary and assistant youth leader at the Highway Church of God, Windsor Place. Her mission is to spread awareness about mental health in the community and to decrease the stigma associated with mental illness. That is a beautiful mission, Dr. Johnson Dames. I want you now to welcome Dr. Tameka Johnson Jane Dames, who will be presenting to us this morning on From Burnout to Balance, Cultivating Mental Health for Physicians. Dr. Johnson Dames.
Good morning, everyone, and thank you for such a warm welcome, Dr. Wallace Bain. So I am presenting, as was mentioned, on the topic From Burnout to Balance. All right, can everyone see my screen clearly? All right, there we go. So I have no financial disclosures or conflicts of interest for this presentation. As we kick off this year's continuing medical education series, it's vital to focus on an aspect that directly impacts both our personal lives and our professional capabilities. Today, we are going to define mental health and explore why being mentally healthy is essential for physicians, recognize signs and symptoms of mental illness, understand burnout and quiet quitting, hear real and honest physician testimonials about things that burden them in their fields, discuss when and how to seek help, provide strategies for maintaining work-life balance and promoting self-care, all while incorporating faith's role in this conversation. So as a start, we have our first question. If everyone can kindly go to menti.com and you will be using the code 27983893. I will pull it up for you. And this is going to be our first poll of the day. So menti.com, type in the code. And once you type in the code, it will allow you to access our polls. So what comes to mind when you hear the term mental health? Someone said depression. The code is right at the top. It's 27983893. Someone said well-being. Unsound mind, yes. Stabilization, that's a good one. Someone else said counseling, another good one. Soundness of mind. Functionality, that's another good one. Psychiatrist, I love it. So we will end this particular Menti with that one, psychiatrist. So back to our presentation. My favorite definition of mental health comes from the World Health Organization, because the World Health Organization defines mental health in a way that I think encompasses everything that it is. That being a state of well-being in which the individual is able to realize their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. So let's explore these key components. First of all, it starts with it being a state of well-being. So mental health is viewed as a positive, flourishing state. It exists on a complex continuum, which ranges from optimal functioning to severe distress. Then we look at self-realization. So you're able to realize your own abilities. This involves an individual's ability to recognize their potential, to manage their thoughts and emotions, and to achieve their goals. Then we look at capacity to cope. So this refers to emotional resilience, your ability to bounce back from adversities, from trauma, from the normal everyday pressures of life. We look at productivity, your ability to function, your ability to learn and work productively. And this contributes to an individual's sense of purpose and fulfillment. And finally, contribution to community. So the ability to engage in relationships and make meaningful contributions to society. That is what mental health is. So what is the importance of mental health for physicians? Studies have shown that mental health or good mental health significantly enhances our decision making, patient care, and overall job satisfaction. It ensures that we can provide the best possible care for our patients, and we do this while maintaining our personal well-being. Moreover, it's linked to personal happiness and a reduced risk of malpractice, which is important, highlighting the importance even beyond the workplace. A healthy physician workforce is crucial to our country's health system, so it's important for us to recognize when we are failing in that regard and develop strategies to improve it. So, what are some of the signs of mental health crisis in physicians? Being a physician, as we know, is a highly sought after career, one with much prestige, but also the stress that is associated with such an occupation. In an article that was titled Mental Illness and Suicide Among Physicians, it was stated that many high pressure, highly skilled occupations have had similar discussions surrounding mental health, and this includes lawyers, first responders, construction workers, and teachers, with each profession concerned that there might be something inherently psychologically toxic about their work that contributes to the high rates of mental ill health that are reported in these industries. So when we look at mental health for physicians, what does that look like? Some of the common signs of mental ill health include ongoing irritability, chronic fatigue, and emotional detachment. And these symptoms may subtly affect daily functioning, but if left unaddressed, can lead to significant mental health crises. The most common mental illnesses in physicians are depression and anxiety. Globally, and this is alarming, around 12 billion working days or 50 million years of work are lost every year to depression and anxiety. So mental health issues cost the global economy around 1 trillion every year. Do you know what we can do with $1 trillion? A whole lot. So this is not a problem that we want to leave unaddressed. Recognizing when a colleague or yourself might be in distress is crucial. So unlike treating a cough or a cold, you can take medications, you can use supportive therapy, and within a couple of days, you may feel better, you may be able to get back to work. When someone presents with depression, depression can be a deep, dark hole. It is not something that you just snap out of. It is not something that someone can tell you, oh, just look at the bright side, you'll feel better. For some people, managing depression can take years of therapy. For some people, managing depression can take several antidepressant trials. And as we know, an antidepressant takes several weeks to work. So someone that is coming in that is unable to function, that is at the point of severe or even moderate depression, you're looking at someone that is unable to function, and they're unable to function for several weeks at a time in some cases. So this is important for us to be able to recognize the signs of illnesses like these so that we can get help and we can get help quickly. So, what are some of the signs? We mentioned that depression and anxiety are two of the top illnesses that are seen in physicians. So, we can break down the symptoms in terms of physical symptoms and mental symptoms. Physical symptoms for depression may include moving or talking more slowly than usual, decreased energy, aches and pains without apparent cause. I know those of us that are over 30, we have aches and pains all the time, and we think that the cause is just old age, but in some persons, it may be depression. Then we look at anxiety. There's elevated heart rate, there's dizziness, there's sweating, there's rapid breathing, and the symptoms that they both share together may include upset stomach, appetite and weight changes, or difficulty sleeping. When we look at the mental symptoms of depression, there's hopelessness. There's losing interest in hobbies or other enjoyable activities. We call that term anhedonia. There's thoughts of suicide or death. And I want to stick a pin in thoughts of suicide or death because there are some persons that you may ask them, well, do you want to kill yourself? Are you having thoughts of taking your own life? And they will tell you no. And when they tell you no, they are being very truthful with that. But if you ask them, do you wish you could go to bed and not wake up? The answer would be yes. If you ask them a hypothetical question, if I told you you could walk through door A and you will live forever, you walk through door B and you're dead by tomorrow, a lot of persons would walk through door B. When we look at mental symptoms of anxiety now, there's fear of injury, illness, or death. Some persons have frequent worrying about things going wrong, and the worry, we describe it as a worry that is difficult to control. Then for some persons, they may have racing thoughts. The symptoms that they both share together include difficulty concentrating and irritability. So those are signs and symptoms of depression and anxiety that we are to look out for. Now, recognizing burnout. Burnout comprises emotional exhaustion, depersonalization from patients, and a reduced sense of personal accomplishment. So everybody go back to menti.com. This time we're using code 19306560. And we have our new Menti question, which states, into it. On a scale of 1 to 10, how burnt out do you feel? On a scale of 1 to 10, how burnt out do you feel? All right, responses are coming in. I'll give it another 20 seconds. On a scale of 1 to 10, how burnt out do you feel? Everybody, we will be using menti.com during the presentation. So please have it pulled up on the side so that you can quickly access it. On a scale of 1 to 10, how burnt out do you feel? Responses quickly coming in. So far, we have 25% of respondents saying that they feel burnt out on a scale of 9 to 10. Only 6% of respondents are saying 1 to 2. 12%, 3 to 4. 28%, 5 to 6. And 22%, 7 to 8. And that number of persons that are saying that they are burnt out at a 9 to 10, that number is slowly creeping up. It is now at 32%. So that means that we have a lot of persons on the call that are feeling burnt out. So back to our presentation. Burnout is associated with psychiatric sequelae such as depression and anxiety that we mentioned, in addition to suicidality in medical practitioners and adverse effects on patient care. I want to highlight one symptom of burnout. So we talk about exhaustion, we talk about depersonalization, we talk about loss of motivation and feeling overwhelmed by work. But there's a term called compassion fatigue. Compassion fatigue is the emotional, physical, and mental exhaustion resulting from chronic, intense caregiving or exposure to others' trauma, often called the cost of caring. So we spend so much time paying attention to everyone else. We hear about suicidality, we hear about abuse, we hear about assault, we hear about loss of limb, we hear about lots of illnesses, whether it be chronic illnesses, terminal illnesses. And for some persons, the mental exhaustion from constantly hearing about these things can cause us to become fatigued. So in 2019, the WHO further described burnout in the 11th revision of the International Classification of Diseases as a syndrome, not an illness or a health condition, but a syndrome that results from workplace stress, get this, that has not been successfully managed. So this is saying to me, burnout is not just, I feel stressed at work, because many of us feel stressed at work. Burnout is you have workplace stress that has not been successfully managed. In an article by our very own Dr. Wallace Bean and colleagues, their study on burnout was described, which highlighted the prevalence of burnout among physicians employed under the Public Hospitals Authority. And this showed that the lack of appreciation and number of years post-internship were the two factors that were mostly associated with burnout. So number one, you're not appreciated. And number two, I've been in this job years and years and years and years and years. The longer you stay in something that makes you unhappy, the longer you stay in a situation where you feel undervalued and underappreciated, the likely you are to feel the effects of burnout. So burnout is certainly a widespread issue that, if detected early, can be mitigated. And understanding these symptoms allows us to intervene before more severe mental health issues develop, improving both our personal and professional lives. So what's one way to intervene? I'm glad you asked. Rest. So we have one more Menti poll. Well, not the last one, but we're coming down to the last one. So go back to menti.com, and this next poll is asking about the percentage of time the body needs to rest. So the code for this one is 69289238. The percentage of time your body needs to rest. What percentage of time does the body need to rest? So answers are coming in. Slowly coming in, we have 28% of respondents saying that you need, well, 4 respondents saying 28%, 7 saying 42%, 2 persons saying 55%, 5 persons are saying 67%. We have 10 more seconds. Okay, so this poll is officially closed, and the correct answer is, drum roll please, 42%. So research suggests that true productivity and well-being come from balancing work with rest. And one effective way to do this is by following the 42% rule. So 42% is the percentage of time that your body and brain need you to spend resting. And it's about 10 hours out of every 24. So no, I am not saying that you need to spend 10 hours asleep, but 10 hours resting. So let's take a look at what that 10 hours means. You have 8 hours of sleep opportunity, give or take an hour. And I know that is extremely challenging in our careers, but 8 hours plus or minus 1 hour, 20 to 30 minutes of stress reducing conversation with your partner or trusted loved one. 20 to 30 minutes of stress reducing conversation is not, how come you didn't pick up the kids from school? It is not, why did you leave your clothes by the front door? It is not, why did you come home late last night? Stress reducing conversation is, yes, I would love to go to dinner with you. Stress reducing conversation is, sure, we can watch a movie, we can Netflix and chill. That is stress reducing. 30 minutes of physical activity. How many of us are physically active? Not active in the sense of I'm walking up and down PMH all day. No, active with being intentional, joining a gym, going for a walk in the park, going for a swim. 30 minutes of paying attention to food. I like this one. This one is my favorite. Why is it my favorite? Because it allows us to explore and engage the five senses. When was the last time you went out to eat and you took note of the way that the food was prepared, the presentation of the food, the garnish that was used? When was the last time you took note of the smell of the food? When was the last time you took note of the flavor? Oh, this is spicy. This is a sweet heat. This is sweet and savory. 30 minutes of paying attention to your food. And then 30 minutes of a wild card. And this wild card could be anything depending on your needs. That could be from what you do to prepare for sleep. That could be what you do in your social time. It could be a hobby. It could be anything that you need to do to relieve stress. And I will leave that up to your imagination. So there is a term called quiet quitting. And quiet quitting might be an insidious manifestation of burnout that is demonstrated by individuals who do not have the option to leave their jobs, example, for financial or other reasons, and hence remain in their current positions while holding disengaged attitudes. So it advocates doing the bare minimum work necessary based on pre-assigned tasks and agreed upon job scope.
Well, recently, there's been this huge conversation about people basically quiet quitting their jobs on social media, which is basically you quitting doing work outside of your 9-to-5 job description. And it's like, yes, as you should, but nobody's talking about quiet firing. And quiet firing is basically when you are doing the work within your job description and you are living up to your job responsibilities. However, your job is not throwing you a check. Why am I not getting a raise? Why am I not getting a promotion? If this is happening to you, your company is taking advantage of you, and you need to loudly quit. What is loudly quitting, you wonder? Packing your belongings and leaving. You don't pay me my worth, someone else will.
So TikTok these days is where people take a stance on how they feel, on things that they feel are an injustice, things that they're happy about, things that they're sad about, things that they're disgruntled about. And Dre is one of those TikTokers who constantly talks about workplace culture. And he's definitely one of the persons that is a proponent for quiet quitting. And a lot of persons, when they feel burnt out, quiet quitting is the next step. So it's important for us to address and discuss how people feel, why they feel that way, and come up with solutions for it. So what are some of the statistics that we have on physician mental health? When we look at burnout, when we look at quiet quitting, what do the statistics show? So we find that mental health issues among physicians are a global phenomenon with significant impacts in the Caribbean as well. And research indicates elevated rates of depression and suicide among medical professionals compared to the general population. So it's not that we are at risk of depression and suicide or anxiety. No, we have elevated rates when they compare us to the general population. So this highlights the unique stresses associated with the medical profession and underscores the importance of proactive mental health management. Both burnout and, by extension, quiet quitting are associated with psychiatric sequelae such as depression and anxiety and suicidality in medical practitioners, which adversely affect patient care. So there is a term called adverse occupational experiences. And adverse experiences that physicians have in practicing medicine are called adverse occupational experiences. There was a study published in Mayo Clinic Proceedings where they looked at 7,360 physicians from the AMA physician professional data who would have responded to a survey in late 2020 and early 2021. And they found that adverse childhood and occupational experiences increased a physician's rate or risk of depression and burnout. Survey responses were collected from physicians practicing in 20 different specialties, and the highest rates of mild to severe depressive symptoms occurred among these 10 physician specialties, and they were urology, emergency medicine, family medicine, obstetrics and gynecology, general internal medicine, physical medicine and rehabilitation, radiology, pediatric subspecialties, psychiatry, and dermatology. So in preparation for this presentation, I thought it would be nice to interview anonymously several physicians across different specialties to get an idea of how they felt. What are some of the things that burn you out? And I know that with each field, there may be differences in some of the things that you view as big stresses. Of course, in TikTok universe, everyone has something to say about their field, about their occupation, about their career. And it seems as though this is the common feeling.
You got to be able to take abuse. You got to be able to have people talk crazy about you. In this business, you got to be able to have people disrespecting you. And you got to smile and you got to pretend like that's okay.
So that is how Will Smith feels, or that is his description of how he was feeling in that moment. But that is how a lot of healthcare workers feel. So with each specialty and each tier, physicians experience different factors that contribute to their sense of overwhelm, whether it be the working hours, the working conditions, the personalities of your colleagues, the personalities of your patients, their loved ones, or even the typical prognosis of the illnesses that you treat. Whatever the challenge is, these all impact your mental health in some way, shape, or form. So in interviewing the different specialties, here is what was said to me. In obstetrics and gynecology, there is anxiety about proper documentation and the high levels of malpractice lawsuits. There's trying to remain empathetic when dealing with sensitive issues, even when it seems routine. An example was given, being on call and getting called for multiple miscarriages in one night. For someone that is really burnt out, for someone that is tired and overwhelmed, you get the call for the same thing. Of course, it's different people, but at some point in time, we have to stop and realize, well, hey, for this particular woman, this is one of the most heartbreaking experiences that you could ever imagine. And so in dealing with that person, you can't show on your face that, hey, I've seen this all night and there's nothing new or special about this case. You have to remain empathetic, and that can be tough. There's inability to debrief after morbidity because, of course, something sad happens with one person, but you still have to turn around and deal with the other person. In emergency medicine, the concerns were limited resources, limited space to see and examine patients, encountering volatile patients with lack of security, In family medicine, there's coordination of care between other specialties. An example given was getting clinic appointments in a timely manner. There's the stress of working without adequate resources. That's come up again. There's poor compliance, and that's poor compliance with medications from their patients. Family medicine physicians also mentioned cognitive overload because they have to manage all ages and all systems. There's a heavy emotional labor and continuity fatigue. There's role strain. They feel as though they have to be the doctor, the counselor, and the social worker. They also say that there's a time pressure with complex patients. There's moral distress in resource-limited settings, exam and research pressure on top of full clinical load, and blurred boundaries as they always feel on. Psychiatry. Inadequacy in patient disposition and poor compliance after discharge, which may lead to frequent relapse and readmission. There's unrealistic expectation that SRC can function as a homeless shelter. There is also a struggle for medical concerns of psychiatric patients to be addressed before they are labeled as another room 2 patient. There's also repeated exposure to details of traumatic events of grief and loss, which can be emotionally draining. And we spoke about this earlier as compassion fatigue. In the Department of Public Health, they mentioned that the workload associated with being the only physician attached to an island or settlement is a stressor. There's political interference, there's difficulty with professional advancement, and there are non-compliant patients who wonder why they are still not well. In pediatrics, one of the biggest struggles mentioned was vulnerability. Some residents feel like asking for help shows weakness and are often afraid. And also the death of any child is very emotionally taxing, especially in the NICU. In anesthesiology, they feel as though there is lack of support, that they are expected to function independently despite being a part of a team, that the load and the strain is not evenly distributed throughout the team. In surgery, their concerns are lack of theater time, lack of staffing, lack of resources, long hours, on-call, post-call, no rest, lack of confidence within the learning environment, and decreased in morale. And finally, internal medicine, lack of supplies hindering work, stationery and forms, blood culture bottles, IV insertion supplies, you name it. The computers don't work and are slow. There's lack of Wi-Fi. They feel that there's limited access to point of care references to the institution. They also mention lack of adequate staffing, that there's medical teams that carry the bulk of the patient burden with often 25 to 40 patients with 2 to 3 registrars or SHOs and 1 intern. They mentioned 24-hour calls every 4 to 5 days with an inability to go home until after the following day's work, leading to up to 32 plus hours of continuous work. Often working 6 days a week, but not uncommon to work 10 plus days continuously without a day off when patient loads become heavy. And there's also poor work-life balance and increased illnesses and burnout. And finally, from internal medicine, lack of non-physician staff leading to delays in care, parting staff shortages leading to missed procedures, nursing shortages compromising patient care, resulting in delays in surgical suite or ICU bed availability. Final from internal medicine, see me after the presentation, please. Management, there's variation and inconsistencies in management style, micromanagement, limited support when the census is high, and limited teaching. So these are some of the concerns from our colleagues. So noting that these are concerns that everyone has, there are a lot of you that mentioned on here today that you feel burnt out. When do we seek help? Knowing when to seek professional help is just as important as being able to spot the signs. So if your symptoms persist and begin to affect your work or personal life, it is time to reach out. Overcoming the stigma and recognizing that seeking help is a strength and not a weakness can lead to a more positive and effective professional environment. And how do we support our colleagues? So, supporting each other is essential for a healthy work environment. Approaching a colleague that you are concerned about with empathy and confidentiality can foster a supportive team culture. A kind gesture and a supportive conversation can sometimes make a significant difference, and it encourages colleagues to seek help if needed. Support is not saying, let me just go see the next patient because this one had ain't no good. Support is also not seeing signs of mental decline in a colleague and laughing about it. Support is not embarrassing someone for crying on the job without an identifiable cause. And support is certainly not turning a blind eye when the signs and symptoms of mental illness are blatant. So, this is a model for how individual and organizational measures could operate to improve physician mental health. And this is taken from an article posted in the National Library of Medicine on mental illness and suicide among physicians. So it mentions what can be done in each stage of our medical career. So one is in medical schools, promoting the development of effective coping skills, normalize help seeking if needed. For junior physicians, training with adaptive coping skills using CBT and other mindfulness techniques. For senior physicians, reinforcing those techniques. For retiring physicians, ensuring appropriate preparation for retirement. As it relates to hospital and health systems, reducing administrative burden, ensuring workplace autonomy, providing job security, improve leave arrangements because like I said, rest is important. Reducing work hours and shifts, improving work-life balance, and supporting effort-reward balance. And for our professional colleagues and external regulators, implementing individually focused interventions, ensuring that the hospital implements changes. Because a lot of times I find that we talk about a lot of things. We say what the issues are. We say what our concerns are. We say what makes us feel burnt out. We say what could be done, but then we don't follow up. We don't go back and take a look at it and say, okay, these are the concerns. This is the biggest stress. What can we do? So implementing mandatory reporting rules. So, in supporting physician mental health, caring for the caregiver, what can be done? Studies by Shanafelt and Noseworthy show that physicians face high levels of burnout, underscoring the need for proactive self-care strategies. So, proactive means we're not waiting until someone is on the verge of mental collapse. We're not waiting until someone is passed out in their bed, not wanting to come to work because they can't take it anymore. It is being proactive. So, our final mentee of the morning, how do you relax and unwind? I find that sometimes there is strength in unity, and sometimes that unity comes from us sharing ideas, us giving opinions about how we feel, about what we do, about what works for us. So, this next question is, what do you do to relax and unwind? Just a second. I see that this left a code and not. Okay, so this one left a QR code, and I'm not sure if you guys would be able to see the QR code. Let me know if you can. If not, we may just have to put those responses in the chat. Yes, unfortunately, we may have to put these responses in the chat if you can. What are some of the things that you do to relax? Oh, sorry, there we go. The code is 6604-5240. 6604-5240. There we go, we got it. So we have here reading a book, sleep, travel, exercising, deep breathing. I love that one. Take a flight, my favorite. Someone said drinking. Is that coffee, juice, rum? Not sure. Listen to music. Bar. I have a great idea. Who put that one? My bar buddy. Spend hours on TikTok. Oh boy. Read a book. Scroll social media. Lie in bed and stare. See me after. Meditation. Watching Netflix. Walking, hanging with friends. I think that one was supposed to be yoga. Someone said cooking, going for a drive, going to the beach, going to church. Hallelujah. I love that one. Binge watching a show. So these are all awesome ideas of what you can do to take time out. Remember, I mentioned the 42% rule, and I said that 30 minutes needed to be exercise. So you guys have exercise on here. I mentioned that there has to be some sleep in there. You guys mentioned sleep. I mentioned that you get 30 minutes for a wild card. So you guys have all of the components, all of the things that you need in order to complete that 42% rule. The only thing that you need is the time to invest. So back to our presentation. When we talk about relaxing and unwinding, we talk about self-care tips. And self-care is not a luxury, but a necessity, and it looks different for everyone. For some persons, self-care may in fact look very luxurious, which is awesome. For me, self-care at some point definitely involves a lash nap or a nice sauna session after a workout. For others, self-care may include low-key activities like walking on the beach. Some people, it may include yoga or meditation. For some people, engaging in hobbies like reading or a craft. Outside of these things, we should all strive to maintain a balanced diet and ensure adequate sleep. Also, physical exercise is crucial for both mental and physical health, which contributes significantly to overall well-being. When we look at maintaining work-life balance, this is also a challenging but a necessary goal. And practical steps like setting clear boundaries between work and personal life can greatly improve this balance. When we sustain this equilibrium, both our professional and personal lives benefit. Because what good is it to be a great internist and a terrible spouse? What good is it to be an excellent surgeon, but an absent parent? What good is it to be an empathetic psychiatrist, but a nonchalant sibling? On the flip side, do you want to spend 10 to 15 years in school to not leave a mark or make a positive impression? Do you want to settle for mediocrity in your career? Absolutely not. So, what are 6 tips for achieving work-life balance? The first is learn to say no. Stop overcommitting. Sometimes you want to be a yes man or a yes woman. You want to be able to help everybody all the time, but sometimes you have to say no. I tell people, go in the mirror and practice your speech. Practice how you're going to tell that person, I really love to help you in this situation, but I really cannot do it. Set clear boundaries. Set clear boundaries between your personal and your professional life. Ensure that you are clearly defining your working hours, and most importantly, stick to them. Sometimes I find myself doing things, and my toddler, he's in that stage of I own you and my time is my time. So if he sees me on my phone or on my laptop, he would tell me close it and put it on the table. And he's adamant he will not leave me alone until I do that. So sometimes it's important to recognize when I'm working, and when I'm spending time with my family, I'm spending time with my family. You have to prioritize your health. How many of you in here, by show of hands, have had your annual physical for 2025? Not just I went and I took one blood work, or I did one lab because I really needed something because I was sick. How many of you went last year to a family physician, to your primary care provider, and did your annual physical? How many of you can say honestly that you were screened for a mental health condition? That's a good one, because just as we prioritize our physical health, we also have to prioritize our mental health. And insurance companies need to prioritize your mental health too, but that's another conversation for another day. So incorporate flexibility into your schedule. So I know that for many of us, the emergency room, they work on shifts. For many of us, you don't have that option of being flexible. But if you can find times on your days off to not be as busy doing things, if you use your time off wisely and take full advantage of the time that you are given. And sometimes that's not just me speaking to the juniors on the call, that's me talking to the seniors on the call and administration on the call. If it is that people are supposed to have a certain amount of time off, they should feel encouraged to take that time off. One of the best things that happened to me when I moved to the Department of Psychiatry, I remember I was working with Dr. Burrows and we were nearing the end of the year, and he said, Johnson, because I was a Johnson at the time, and he said, Johnson, you didn't put in for your casual days. You have 10 casual days. And I was like, oh, okay. Now, I was just coming from internship. So for me, coming from internship, casual days wasn't something that I thought about. But he was like, no, you have to make sure you take your time so that you could rest and do something fun and enjoy yourself and relax. And I took that with me because I said, something, this is crucial. This is crucial to my ability to function as a physician. It is crucial for me to be able to get that time away so that I could spend time with my family and with my friends. It was something that I didn't think about before that point in time. So as for other departments, if it is that you can't afford persons the time off because of staffing, then we need to fight for more staff. Because if we have persons that are on the job that are tired, that are overworked, that are burnt out, they won't perform at their best. So we may have excellent surgeons, excellent internists, excellent emergency room physicians, but tired physicians will not perform in excellence. And with that note, we will move right along. The role of faith in mental health. So for a lot of persons, there is a perception of mental health that your faith can certainly shift. So faith significantly influences how people perceive mental illnesses. In many communities, spiritual beliefs shape attitudes toward mental health, which can vary greatly. Religious beliefs may support or stigmatize mental health understanding, such as viewing mental illness as moral failing or spiritual challenge. If anyone on the call is Pentecostal, you know that for a lot of mental health conditions, it is seen as a demon. It is a spiritual attack. It is something that you need prayers for. It is not something that you need to see a psychiatrist or a psychologist for. It is something that if your pastor or your priest has to refer you to a mental health provider, for some of them, they view that as a failing because this is something that they should be able to pray away. So religion can definitely shake or affect how you view mental illness and how you view the treatment of mental illness. On the other side, there are some religious beliefs or providers, organizations that believe that mental health is critical and that professional support is helpful, that you can pray and still go to therapy, that you can read your Bible and still take a medication. So it's important to note that when it comes to faith, our personal faith or spirituality can provide profound strength, resilience, and community support. So, our mental health is as important as any other professional skill. Taking proactive steps to manage our mental health not only benefits us, but it also enhances our ability to care for our patients. Let's remain vigilant, let's support one another, and let's foster a culture that not only recognizes mental health or mental illnesses, but takes a proactive approach to prioritize our mental health. And these are my references. And I thank you guys for being a wonderful and engaging audience here today. And please go throughout 2026 focusing on your mental health and being proactive in your fight to ensure that you are mentally healthy. Thank you.
Thank you so much, Dr. Deems, for a wonderful, wonderful presentation. I see lots of emoji reactions floating across the screen. You have definitely delved into some very important topics. You were very comprehensive in your presentation. You provided your presentation with great energy and vigor to keep us all excited and in tune and engaged throughout the entire presentation. Now, as I said, there are a lot of emojis floating around on my screen. Let's just jump over to the chat and move beyond what we do to relax. And there we go. Dr. Rhonda Carter, great presentation, Dr. Johnson Dames. We have some prayer hands and very good presentation. Many thanks. Thank you, Doc. Let the church say amen. Amen. Excellent presentation. Great presentation. Thank you. Timely and engaging. Thank you. Very good presentation, Dr. Johnson Dames. Excellent presentation, Dr. Dames. I think it's safe to say that your presentation was very well received by our very engaging audience this morning. Oh, there goes another one. Thoroughly enjoyed. These reminders are so important. And I absolutely love that. We have to forever be reminded. I saw that my specialty on one of those slides were kind of high. Oh dear. You know, we will definitely ensure that among our group of physicians, we do what is necessary to ensure that our physicians prioritize their mental health so that we can be our absolute best for the patients that we serve. We have some others that have come in. Lovely presentation, Dr. Dames. Okay. Do we have any other questions or any further comments for Dr. Johnson Dames? Okay, please, as you have thoroughly enjoyed the presentation this morning, please ensure that you complete the CME feedback link. It was just placed again in your chat. Click on it and provide us with your feedback. This is very important in us being able to help you to receive your CME credits in a timely fashion. Also, if you are on the call with a name that is not registered with the Bahamas Medical Council, please ensure that you change your name, rename yourself so that you can be identified and be able to receive any credits associated with any of our presentations. Okay, I do not see any additional questions or comments or floating emojis. So, with that, I would like to take the time to thank Dr. Tameka Johnson Dames for a wonderful, timely presentation to get us started at the beginning of our year. And I hope that each of you feel more energetic and rejuvenated to ensure that you get that appropriate rest so that you can come to work and give your absolute best to the patients that we serve. You have just leveled up your knowledge with the Department of Continuing Medical Education, and we hope to see you at our next session, which will be the second Wednesday of February. Have a wonderful day and an amazing, restful weekend.